This is a podcast of the Nuffield Department of Medicine. Today we speak with Professor Paul Newton about the issue of poor quality medicines. Morning, Paul.
Good morning.
Why are poor quality medicines such a problem?
I think they're a major problem for global public health because most of us take medicines and they're a crucial part of our well-being, curing disease and preventing disease. And if they're not, if they do not contain what it says on the packet, if it contains none or less of the stated ingredient, then that's clearly a severe problem for our health.
How common is it to come across a poor quality medicine?
They're very variable across the world. No countries are immune. There have been recent severe problems in the US and elsewhere in the wealthy world, but the people most afflicted by this are probably the vulnerable people in lower and middle income countries who do not have facilities or the regulatory authorities to regulate and police the drug supply. I mean, one current example is a large epidemic of anti-malarials in West and Central Africa, where many countries have in the distribution chains falsified anti-malarials containing no active ingredient, and so patients with malaria will effectively have no treatment. And that's a major issue across large parts of Africa.
How can this situation be improved?
I think the key thing is more political will, more interest in the subject, but the most crucial practical intervention is to improve medicine regulatory authorities globally. We're very lucky in the UK in having a very active, well-funded medicine regulatory authority, but WHO estimates that 2/3 of nation states do not have that. And they're the keystones for improvement and regulation of the drug supply. And without that, I don't see how we can have a good drug supply.
What are the most important lines of research that have developed in the past 5 to 10 years in this area?
I think a key thing has been a better understanding of the epidemiology of the problem globally, where it's a problem, what are the driving forces for it, and an increasing understanding that there are two different types of poor quality medicines. Falsified medicines, which are otherwise known as fakes, which usually but not always contain no active ingredient and will have no therapeutic efficacy if one was to take them. And then substandard medicines that are the results of poor quality manufacturing by genuine manufacturers, which isn't, it's a problem of negligence and errors rather than deliberate criminal fraud.
Why is this research so important and why should it be funded?
I think globally most of us take medicines, and if they're not what they say they are, if they don't contain the right active ingredients, if they're the wrong active ingredients or no active ingredients, that will inevitably impact on all of our health, and that it's a crucial thing that we need to get sorted. It's rather extraordinary that in 2016 we still have multiple cases of poor quality medicines globally.
How does this research fit within translational medicine within the department?
I think it's intrinsically a translational work in that the research that we're doing, the aim is to influence health policy directly, to give evidence, to raise its political profile, and to use it to try and ensure that we do see for the next generation an improvement in medicine quality.
Thanks very much, Paul.
Thank you.